My mother was harmed twice during hospital stays, and I saw not only the battle to recover for her, but also how it broke a bit of my father's heart as a physician to see institution he was affiliated with could let this happen and not work as hard as was possible to make sure it didn't happen to anyone else. And I reflect a lot for healthcare workers who, despite their best efforts, end up participating in harm or being harmed themselves. Their whole lives change. And for the 1,150 healthcare workers who we've lost to COVID so far, their lives are over. And each of these incidents and each of these deaths is completely unnecessary. So we have work to do.
When I think about patient safety, I always think about it in very much the same light as I think about employee safety. So I think about if we are okay with any level of patients being harmed or employees being harmed, then it really requires somebody to raise their hand and say, yep, I'm willing to be that person to be hurt. And the reality is, I don't think anybody wants to be that person who's hurt. So when I think about patient safety, I think about it under the lens of, first of all, kind of myself and my immediate family, people that I love, friends, and quite frankly, then my community and even the whole, essentially the whole world. I think all of us expect, and really what it comes down to for me is the word that comes to mind is trust. We expect if we go into a health system anywhere that we're going to have not only high quality care, that we're going to get the outcome we're looking for, that we're going to be made to have better health than when we came in, hopefully, but we're going to expect that that's going to be done safely, that we're not going to be harmed in that care process. So I've seen examples, I'm not going to give you a specific example, but I've seen a number of examples where between family members and friends, or even just patients that I've had the opportunity and the fortune to have spent time with, where they've been injured. And when that happens, the impact is really widespread. The impact to not only that individual, to the people that care for them and love for them, but also for all of the entire caregiving team. I know a lot of great people who are caregivers, and I've met so many people over the years who are really, really just passionate about providing better care for patients and helping people. So I've seen what happens when patients get hurt, from the aspects of what happens to them, what happens to their family, and to the entire caregiving team. And I've yet to ever meet anyone who wants to come into work any day and, one, be injured, but secondarily to ever injure a patient.
There are two aspects of safety that come to mind for me. The first is personal. I had a childhood accident, and if not for the skills of the EMS team and the emergency department team, I wouldn't be here today. So I have a great deal of gratitude for them and the care that they provide. That environment of care is important to me. Patients seek care, but healthcare is notoriously dangerous for patients. They're the third leading cause of harm. So creating an environment that people feel safe to practice, don't have the distractions of harm, is important. It will allow them to be able to concentrate on caring for patients, creating safety for themselves and the patients that they're there to serve.
So this theme is really important to me because it literally goes back to my earliest childhood memories. Both of my parents had repeated chronic and acute healthcare needs, and they never would have lived to my adulthood without the wonders of medical science. But the tangible lack of safety and the chaos in the system was just so vivid to me, even as a child, when you would go visit them in the hospital or have encounters with the healthcare system. Both parents, over the course of my lifetime, experienced numerous medical errors and problems. And my mom's life was actually shortened, and the last year of her lucidity was compromised by a medication error. My father, though, was also a physician, and he was really a legendary radiation oncologist who created the means to improve millions of lives. But he, as a worker, was harmed by radiation. He was doing this work back in the early 50s when it was just beginning, and they were harnessing the power to improve and save lives. but his life and many of his healthcare issues were caused by that radiation exposure. So finally, then into my professional life, as part of helping found the Pittsburgh Regional Healthcare Initiative and Value Capture, I was fortunate to take those learnings and those experiences and be able to be mentored by Paul O'Neill, who believed and proved that leadership of an organization can be great, and an organization can't be great without eliminating harm for its workers. And I remember being skeptical at first that the focus on worker safety could be such a singular driver of excellence for everything that you do. But in my coaching of leaders for this past 20 years, I've seen example after example of the devotion to workers as the keystone of almost miraculous improvements of organizations in worker safety, patient safety, and everything else. So that's why, for me, worker and patient safety are really sort of driving beliefs in my life, and why I think they're so important in the world. Thank you.
So this is my nephew, Scotty, born September 2008. He was born with a heart problem that they knew about, but within days had to have open heart surgery. Surgery went well, but then it happened. A hospital-acquired infection. Within another day, he needed to be opened up again, and there was a period of time where it was unclear if he would live. And the infection attacked the blood flow to his hip, and since then, he's required 3 additional surgeries and will need a hip replacement in the future when he stops growing. So Scotty celebrates his 12th birthday this month, and he continues to battle the lifelong effects of conditions brought on by something that was avoidable, that infection. In healthcare, we have too much waste, weight, and harm. You don't have to look far to find examples that you, your family, or your friends have experienced. We can do better. We have to do better.
I have to say that I've been pretty lucky in my life when it comes to being a patient or when a family member has been a patient. No measurable harm has ever occurred, at least that I know of. There have been some near misses for sure. I think of an aunt who underwent emergency appendectomy, and after she got out of recovery, she was taken to a unit and put in a 2-patient room that was so small and crowded that she nearly tripped over the many IV and monitor cords that were on the floor when the nurse got her up to have her walk a bit following the operation. Oh, this is the worst room on the unit, and it's much too small for 2 patients, the nurse said. You could practically see her shrugging her shoulders with that, resigned acceptance of the situation. There was also my own experience where the ER doctor declared that I had diabetes and offered to send me home with metformin. I didn't have, and I do not have diabetes, and my PCP just shook his head when he let me know that my low blood sugar that day was due to other non-serious reasons, and most certainly was not diabetes. I don't blame the providers. I know the caregivers all want to give the best care possible. There is not a single doctor, nurse, aide, or anyone else in the hospital that wants patients to have poor outcomes, delayed recovery, or have to be readmitted. They and everyone in U.S. healthcare struggle with poorly designed and unsafe work systems, insanely complex and burdensome payer systems, and time-sucking and soul-sucking administrative and other so-called systems that divert focus from what their job is and what they really want to do, why they're there, to help patients get well and stay well. With better systems, I believe that everyone in healthcare would be better able to do their jobs, to do their work, They themselves would be safer and more fulfilled, and patients would experience better outcomes and more quickly return home safe and well. So that's what this is all about.
So patient safety to me is really personal. My father-in-law experienced a medication error almost 20 years ago, and he died as a result of that. And it was really hard. They were wonderful people, but it's such a complex system that they have to work in. And then later, my son was in a pretty traumatic accident. And I mean, this was a decade later. And similar things happened again. Again, the most magnificent people, but communication errors, some medication errors, and we nearly lost him. So that's why it's so important to me. I know I'm not alone in having experienced these errors with my family. I just know I'm not alone. And so that's why I want to be part of the solution. Fantastic people doing fantastic work in systems that don't always help them be successful. So patient safety is personal, and that's why I want to be part of fixing it.
I'm wearing this zero hat from the Patient Safety Movement Foundation because, as the late Paul O'Neill said, zero is really the only goal that we should set, whether it comes to employee harm or patient harm. Now, zero can be an inspiring goal if we have the right kind of leadership. Now, safety is important to me because I've just always believed from different workplaces that nobody should be hurt at work. This is true in healthcare. And from the patient side, nobody should be harmed by errors and mistakes that occur in healthcare. Now, patient safety isn't important because I've been affected personally, but I've met far too many people along the way who have been. And I appreciate when they react with love and with systems thinking in ways that help others avoid being harmed. People like Laura Townsend, who started the Louise Batts Patient Safety Foundation after her mother was killed by a preventable medication error. I think also of Chris Jerry, who started the Emily Jerry Foundation after his infant daughter was killed by a preventable medical error. And Sorrel King, whose daughter Josie was also killed by a preventable medical error. And people, when this occurs, they often think they're alone, that this doesn't happen to many people. But the sad reality is that harm and death from medical error are far too common in the United States and around the world. That's why it's important to me. That's why I work to help reduce, eliminate, and prevent harm, because it turns out it is possible.
I believe caregiving for another human being in their time of need for medical care, when they are oftentimes the most afraid and most vulnerable, requires extraordinary compassion. And this is not just a profession, but truly a calling. Caregivers every single day go to truly heroic efforts to care for others, oftentimes risking their own lives for those they care for. We have to keep our caregivers safe. We are morally obligated to work together and use the science and tools of system design that we know of to help reduce healthcare worker burden. The little things, the big things, the waste, and all the things that make caregiving unsafe and harder than it has to be. This is what drives the work I do every day. I say thank you to every healthcare worker around the world. You are a hero, not just in these times of crises, but every day, all day, in the most ordinary of times.
I don't believe that this is a matter of desire. I think it's a matter of, do we have the processes? Do we have the systems in place to be able to conquer reducing patient safety events to zero? And the great thing is, when we think about it in aspects of a process or a system, then it's conquerable. It's something we can overcome. So as I think about patient safety, to me, it seems daunting, but it's not insurmountable. And that's the great thing. So for me, if we can work on all of our processes, work on our systems, and collaborate with all those super passionate caregivers who want to do the right thing and want to have the best possible outcome for patients, then I think at that point in time, we create better processes, we create better systems. And in that light, then we can create trust. And for me, just personally, as I right now have a loved one who is in a medical facility who is battling a pretty serious disease, I think about them, and I think about, I really hope that they have the safest possible care. And in that, when I have to even think about that as a question about whether or not they will receive the safest care, leads me to really think about, I don't have the trust that I want. So I think patient safety for me comes down to, it is fixable. We can get to perfect patient care, and we can get to fully safe care. And when we do that, then we'll have full trust. I think when we get there, then not only will that feel amazing as a caregiver, that'll feel amazing as a patient and as a client of health systems. So when I think about patient safety, I think about trust as the end game, getting to the point where everybody, team members coming to work and being safe every day, providing safe care, and every patient and their family expecting and trusting that they'll receive safe care no matter where they go.